Prescription drug overdose is one of the leading causes of accidental death in the United States, and Idaho is one of the worst. The crisis of the opioid epidemic has been going on for years, but much like an overdue volcano, has recently begun to erupt into bigger problems. On May 3, 2019, an article was written announcing a lawsuit filed by local governments to sue drug makers. This issue has many contributing factors and parties involved, and the Idaho Medical Association is one of them. They represent all of the doctors who are actually the ones prescribing these drugs. Throughout all of this, the IMA has remained completely quiet about the matter. They have not accepted responsibility or addressed the media regarding this issue in any way. This strategy is not effective because it is giving them a bad name while they sit back and let all of the drug makers take all of the beating, while in fact they are the ones issuing all of the opioids out like candy. It is appropriate for the IMA to bolster their image by a crisis briefing, taking responsibility, and discussing ways in which they can improve. The hypothetical date of this crisis briefing is set for June 1st, 2019. The strategies that will be used are good intention and mortification. This approach will be much different than what the IMA is currently doing, because rather than remaining silent, they will be improving their image by taking ownership through the mortification strategy. This strategy is the most important for the company because a lot of respect will be given to them by accepting a large part of the responsibility for what has been happening. The reason this will be most effective is because many of the audience are everyday Idaho locals who this has been affecting. It will bring them comfort to know that the doctors will be putting things in place so that they can feel safe and secure when trusting medical professionals that are prescribing them painkillers. I will now begin the attention getter and start my crisis briefing speech. Prescription painkillers have been the leading cause to accidental deaths in the United States. This is disheartening because it is an issue that we have control over. Many fingers have been pointed to who it should be blamed for this opioid epidemic. My name is Crisis.Berry, and I am the president of the Idaho Medical Association. IMA's mission is to unify and advocate for all Idaho physicians, promote the art and science of medicine, and remain dedicated to improving the health and well-being of all Idahoans. Throughout my time at IMA, I can attest that improving health and well-being of all Idahoans is the number one priority. I have been working with medical professionals and in the medical industry my entire life, and I am very aware of the opioid epidemic and all of the details surrounding it. Let me begin by explaining IMA's side of the story. 10 years ago, a pain-stricken patient could walk into a medical office and explain all of the pain that they are having in their lower back. Because all that doctors want to do is help you improve medically, oftentimes, to reduce the pain, doctors would provide a chronic opioid drug that assists in nullifying and helping the patient recover. These drugs became easy for patients to become addicted to, and unfortunately, many physicians were prescribing them for almost every scenario dealing with pain. Throughout the years, patients have relied heavily on opioids, and it has become a serious problem, with high hospitalization rates and deaths due to opioid overdose. According to the National Institute of Drug Abuse, in 2017, there were more than 70,200 overdose deaths in the United States. These deaths were caused by opioids. To help you better understand the seriousness of the situation, the Center of Disease Control, or CDC, states that on average, 130 Americans die every single day from opioid overdose. These numbers are unacceptable, and we must do something about it. Let me be clear that our prescribing physicians have the very best intentions while providing care to patients in Idaho. Pain is subjective, so if a patient comes in complaining about pain, we can't effectively call them a liar and not give them pain medication. So, we thought we were doing our best to treat our patients. Fast forward a few years, and now several of our patients are addicted to opioids. However, rather than putting the blame on others for the cause of this crisis, as the president of the IMA, we are accepting full responsibility over this matter and have decided to take ownership over the issue by providing 2 solutions of how we can make this situation better. First, the IMA will be suggesting to legislation that for the use of the Prescription Monitoring Program, or the PMP, that it must be checked regularly by all prescribers. This is important because it can prevent pharmacy shopping and allow patients to get multiple prescriptions for opioids because health providers will be on the same page. The PMP provides data throughout the state and surrounding states for all controlled substances regarding prescription fills at any pharmacy. It is obvious that this will help in ethically issuing these substances. The second solution is to provide training to doctors prescribing opioids and treatment for opioid disorder as well. If prescribing practices are improved, doctors will better be able to assist in knowing when to prescribe opioids and how to treat people who are addicted to opioids. The CDC has offered guidelines for prescribing opioids, which is much lower than previous amounts. According to the National Institute of Drug Abuse, in 2017, Idaho providers wrote 70.3 opioid prescriptions for every 100 persons. While this represents Idaho's lowest prescribing rate in 10 years, it remains higher than the national average of 58.7 opioid prescriptions. It is clear that this is unacceptable, yet should be noted that we are improving and we are striving to improve that number each day. It is clear that additional training to our providers will be extremely beneficial in this matter. Today I have discussed 2 solutions to assist in the improvement of the opioid epidemic. Although good intentions have been there, we accept full responsibility for our prescribing matters, and ultimately, we are here to help all Idahoans have a better and healthier future. Thank you for your time. What questions do you have?